My presentation today will be based on like a long-term process in Lithuania, which maybe could be described at a political level as deinstitutionalization. And there are some very particular policies or programs like program at Ministry of Social Affairs and Labor on deinstitutionalization, which was adopted in 2014. In sector of healthcare, there is no particular policy or program, but there are a number of initiatives or changes which also are considered very important in the framework of deinstitutionalization. As Lithuania, as other post-Soviet countries, is considered as a we have the infrastructure which we inherited from Soviet times, which was very much institutionalized. So there is a way and there's approaches towards that, different approaches probably. And one of the approaches which is very important is a human rights-based approach for mental health, because it may help, it may support this transition to be in line with real human rights standards and which deinstitutionalization is heading at. And I will really refer the experience looking at this issue based on Quality Rights Initiative. Quality Rights Initiative was started at the WHO as a tool, right, to assess and also to improve mental health and social care services. It's important to understand that assessing mental health or social care services towards human rights standards and quality is just the first step. It's the initial step to get the insight, to gather the baseline, but the main activity should be changed, right? Should be facilitated to look for priority areas, to look for areas of improvement, and to make some very particular plans and some very particular trainings if needed. Quality Rights Initiative and this particular assessment tool is based on CRPD, that's Convention of Persons with Disabilities, Persons of Disabilities Rights, and there are 5 areas, 5 themes included into quality rights, which are assessed in a very like a detailed manner, and those topics are just in front of you, right? It's a right to adequate standard of living and social protection. It's the right to enjoyment of the highest attainable standard of physical and mental health, right to exercise legal capacity and the right to personal liberty and the security of the person, freedom from torture or cruel, inhuman, or degrading treatment or punishment, and from exploitation, violence, and abuse, and right to live independently and to be included in the community. All these topics are assessed using the methodology proposed, which is global. I mean, if we use it in Lithuania, it may be used in all the countries and maybe different, there may be different practices, but the standards are the same, right? We are looking for the same issues and the same standards according to CRPD, which is global. So practices in country may differ very much. And what I tried to gather today is their findings from 10 facilities assessed using quality rights assessment tool, which took place in Lithuania like last 5 years, from 2016 to 2021. And those assessments were very conducted by the quality rights team, trained and by WHO. And you can see that colleagues of mine, Nijolė Goštautaitė-Midtun is a psychiatrist, medical doctor, Ugnė Grigaitė is social worker, Dovilė Juodkaitė is a lawyer, myself, I'm a psychologist, and it's very important to have this division, this very different angles to look at, professional angles to the situation. And that is not just our team, it's an idea of WHO Quality Rights Initiative to have these different specialists included into quality rights teams around. And you can see the vision of what kind of facilities were assessed. And these facilities were assessed using the three main tools. It's interviewing people, interviewing residents, patients, staff workers, administration, and also people like relatives or family members should be included, but we didn't have any. And that also indicates something, right? That our facilities don't really include much everyday involvement of these family members. And 4 kinds of institutions or facilities were visited: the independent living homes, it's social care, social support institutions. There were social care homes, big social care homes, or small, but they're social care homes for living for people with disabilities, with psychosocial or intellectual disabilities. There are psychiatric hospitals or units, and there were group living homes. That means that people, up to 10 people, are living in some house which is located in the community. And findings are, I will show you some tables which details every theme, every topic, one of the 5 themes, into smaller standards. But actually, when we look at the situations and when we explore that more in detail, we look at the criteria which are under the standards, which are even more detailed. So very detailed situations are really captured by that tool, very practical, and I find it very insightful for the system, back to the system, what really we have, not in every facility only to be improved, but we can find at the systematic level. So for example, this, I'll try to, is there some, I'm a little bit afraid to push the button. No. Okay, but I'm trying to, the red spot, but I don't think it's here. Okay. So the right to an adequate standard of living. And we can see that in general, there are 5 measurements which can be, kind of which indicate the level of achievement in that particular area. And achievement can be achieved in full. That means everything is done in that particular situation or direction or for that particular standard. Achieved partially, that means that something is really in place but has to be improved. Achievement initiated, that means that something has been just started, but considerable improvements are needed. And achievement is not initiated, that's just missing, that nothing is about that direction. And sometimes it's not applicable when some areas are not to be considered for that particular, let's say, facility, and some areas are not to be assessed at all because they're not considered as a existing, or something is not really not really about to, not possible to assess something in some cases. Well, and we can see that in general, the physical conditions are really good, and there are still still some achievement-initiated areas, but in general, partially achieved or achieved in full. This table indicates that this theme is under development, maybe in different facilities. It may differ, but still it's considered as a quite good picture, right? And but we can see that facility provides welcoming, comfortable, stimulating environment, conducive to achieve participation and interaction. This is actually the area, right? It's in some facilities to be improved. Or service users can enjoy fulfilling social, personal lives and remain engaged in the community life and activities. In this area, we maybe have some more, achievements to fulfill yet. If we look at the right to enjoyment of the high sustainable standard of physical and mental health, actually it's very difficult, because just to frame it into that level, because very special details are under these criteria, which a little bit gives more insight. I'll try to get back to the conclusions. But in general, we also see that treatment, psychosocial rehabilitation, and links to support networks and other services are not really achieved in many areas or not initiated, right? That's an important message, that something about networking, something about service-driven recovery plans or contribution to service ability to live independently in the community. Around that area, we have much to do. The right to exercise legal capacity and the right to personal liberty and security of the person. Of course, there are some procedures and safeguards to prevent detention and treatment without free and informed consent. That's the area to be of improvement, which is considerable. And services users can exercise their legal capacity and are given the support they may require to exercise their legal capacity. It's very area to be considered in many institutions, facilities. Okay, theme 4, which is freedom from torture, cruel, inhuman, degrading treatment or punishment, and from exploitation, violence, and abuse. We also see that there are different situations. Sometimes it's not really applicable. Some parts of this standards. But still, we see that in social care, especially, right, there's there's missing some situations when to prevent that people wouldn't be abused and administrated only with the free will and informed consent of the service users. And also safeguards in place to prevent torture or cruel behavior are not always in place, or not, sometimes they are at the achievement just initiated. Well, on topic 5, it considers right to live independently and to be included into community. There are also some areas like service users can access education and employment opportunities, which indicates the lack maybe of some services or some initiatives here. And also service users are supported in taking part in social, cultural, religious, and leisure activities, right? It's something to be considered. Well, this is just general picture, but it's, we have to look at details to find the right findings. And what insights can be really brought from this like a very accumulative view to this very different, very specific then facilities which differ from, in their capacity, in their, how big they are, or what their primary like a operation or results driven the different levels and for different results. So for the topic 1, it could be considered that really we have good buildings and we have refurbished them well, but still privacy and accessibility for people with physical disabilities are missing. When we talk about highest attainable standard of physical and mental health, we face no discrimination. Everybody can access the service. Actually, physical health is well monitored and delivered and facilitated. But let's say trainings on COPD from academia to qualification trainings, recovery approaches are very much missing. About legal capacity, there are situations when even the facilities initiate the restoration of legal capacity, but in general, we have to talk that admissions and treatment is not always based on the free will, and the social sector and psychiatric sector, there are different situations, but still, this area is, has to be considered. And advanced directives and supported decision making, I mean, they are not facilitated, they're just missing. And what we have from freedom of torture, that we actually didn't find much of like, rare cases when people report some abuse, but still the escalation is missing, training on de-escalation, preventive mechanism of abuse are still missing much. And when we talk about the right to live independently and be included in the community, we find that really, though we have new forms of housing, there is no chain towards independent living. And this is very, systematic situation. And of course, general service are sometimes missing, especially in education and occupation situations. Right, that's it.